Hey everybody, Roger Levin here with a dental business insight from Levin Group focused on the COVID-19 crisis. I've been doing a lot of webinars on behalf of companies and dental organizations to help their customers and members figure out the best strategies to put into place to get ready for recovery. Our entire focus at Levin Group is on the recovery phase, even though we don't know exactly when that will begin. We also estimate that when it does begin, the recovery phase will take about 6 months for most practices to get back to 80 to 100% of their normal production levels. Having said that, one of the things practices should be focused on, or questions that I'm getting, is when should you start reappointing patients who do not have an appointment? Some practices have already started to reappoint patients, and that's fine. The problem with that is that we don't know when we're going to be operational. So if you reappoint patients too early, you will be, new word, reappointing patients again, and maybe for a third time. My recommendation is to wait until we have a sense that we're going to be moving back to the office, and then you want to have a very aggressive, positive approach to contacting patients to come back. You're going to want to call them. Don't just text them. You're going to want to call them so that you can touch them, you can reassure them that all safety precautions are in place. If you can quote a national organization, for example, if the American Dental Association says, okay, it's safe for patients to go back into practices, that will go a long way to reassuring patients. Because we've got categories of patients that won't be back. This would include people who can't afford to come back. They have financial challenges. This will include people who are afraid to come back because they are just not convinced it's safe to come in. So we want to do everything we can. And then once we work through lots of contacts with overdue patients, move them to a 90-day cycle, because some will come back at 90 days, some will come back at a year. But you want everybody back that you can possibly attract. As always, we wish you dental business success, and I wish you safety and health.